of these xenoestrogens greatly increase the estrogen load that you have to handle. And one way that you can try to arm yourself against these xenoestrogens is to take supplements that have weaker estrogens, which are called phytoestrogens, and they seem to be able to block the estrogen receptor. And estrogen receptors are these molecules on the cells that attach to and respond to estrogens. And if these weak estrogens are on the receptors, they are occupied so that they cannot be stimulated by these xenoestrogens that can be up to 100 times stronger. So that's the importance. Even though the phytoestrogens are a estrogen, they're a weak estrogen. And so they're going to have a weak message to the breast and to the uterus that they will grow very slowly instead of growing at a more intense fashion if they are subjected or responding to a xenoestrogen, which is much more potent. This is a very important issue to women and the public, but it seems like the medical profession is light years behind in this idea that problems that women are facing may have more to do with too much estrogen and too little estrogen. Why is the medical community so far behind? Well, conventional thought for the last 30 or 40 years has been that estrogen replacement is a panacea for women. We thought it was beneficial in heart disease. We thought it was beneficial in Alzheimer's disease. We thought it was beneficial for hot flashes. But that has all been disputed now that we finally have studies like the Women's Health Initiative that is showing that it is false. However, old habits die hard. And also you have to understand that the medical community primarily gets its information from pharmaceutical companies, from pharmaceutical-sponsored continuing medical education, and the pharmaceutical industry has a vested interest in keeping the benefits of estrogen, whether they be real or fictitious, in the forefront of medical education and to sequester some of the information that may be contrary to the benefits of estrogen. The Women's Health Initiative was supposed to once and for all answer the questions about estrogen, and all of its findings have been negative. However, again, the medical community has been very slow to accept this information and has really kind of been in an uproar trying to point out any fallacies that may be a part of this study. So unless you are willing to go outside the box, look at information that may not be the most readily available to you, look at information in a critical fashion and not just accept the status quo and be comfortable in doing what you are always doing, then you're going to continue to do the same things. You're going to continue to prescribe birth control pills and hormone replacement. You have to be willing to step outside the box. And what seems to be adventuresome or pioneering now, I believe in the not too distant future will be commonplace. So the wheels of medicine turn slow. It takes about 10 years for anything to really change in medicine. And usually most changes are spearheaded through a grassroots movement. I often give the story that doctors did not get together 15 years ago and say, let's make having a baby in the hospital more comfortable, more like home. Let's not treat it like a sickness. No, it wasn't started by the medical community. It was started by baby boomer women who were having babies and said, I'm not sick. I'm not going to a hospital in order to deliver my baby in a sterile fashion. And now they build these cathedrals for birthing centers. The same is going to happen with menopause and with hormone replacement. Intelligent baby boomer women are going to demand changes. Information, as we are discussing here, is going to get out to the masses, and they're going to force the medical community to change. And I really believe that, and that's why I'm taking part in this effort to motivate the grassroots, educate them so that they will force medicine to change, because they're not going to do it on their own. What I had been faced with in my office for the first 7 or 8 years of practice was patients' complaints were the same. Patients complained of 2 weeks before their period being unable to control their moods, unable to concentrate. I had patients who would say, I wouldn't have gotten a divorce if I had have understood what was going on with me for those 2 weeks before my period. I had patients tell me that they are not productive on their job a week or two before their period because they can't concentrate. They're so uncomfortable with bloating, breast tenderness, irritability, irregular bleeding. They've lost jobs because of this. Patients complain of migraine headaches, keep them at home for 2 or 3 days out of the month. Marriages are broken up because of infertility problems that could have easily been corrected if estrogen progesterone problems had been corrected. Osteoporosis, due to the misunderstanding of this, patients have been taking drugs that have irritated their gastrointestinal system and have really been fearful about not being able to prevent the osteoporosis, and something that's totally preventable if you understand what's going on. Multiple surgeries have been done because of fibroids or irregular bleeding due to estrogen progesterone problems, perimenopausal symptoms, increase in weight. Patients have been put on thyroid hormone because estrogen blocks the function of thyroid. Patients are having symptoms of hypothyroidism, which is depression, weight gain, fatigue, constipation. And really what is going on there is a overload of estrogen, which is making the thyroid not be able to function properly. They don't really need synthroid or thyroid hormone. What they really need is help to help them balance their estrogen and progesterone. Again, I'll go back and state my wife. I thought that the vows that I took that said for better or for worse were the fact that for 2 weeks our marriage was better, and for the 2 weeks before her period it was worse. And I thought that that was the deal that I had signed up for. But once I understood estrogen and progesterone and helped her to use progesterone cream, and we changed our diet, we changed our kids' diet in order to make sure that even my little girl who's 7 years old, that we teach her how to eat and what she needs to do to prevent all of these problems in the future for her. So it is really a problem that is a true epidemic, and women have just become so frustrated that they have just learned to accept living with these problems. But what I want to do is to get this information out that they do have the ability to change the way they feel and to affect their future health, their future relationships, their future productivity if they understand and take action and not accept the status quo from the medical community that all we have to offer is synthetic drugs and surgery, that there are other options out there available. 75% of the world does not take birth control pills. They don't use hormone replacement. And they also don't have osteoporosis. They don't have the risk of breast cancer that we do here in America. They don't have the rate of hysterectomies that we have here in America. And it's all because they have a different lifestyle. They have a different diet. They have a different environment. They're not exposed to the pesticides, the xenoestrogens that we're exposed to. So I really wanted to hit home that you don't have to live with this. Your relationship doesn't have to suffer because of it. Your job productivity does not have to suffer because of it. If you educate yourself and you do the things that you need to do, and a lot of these you can do with the physician's help, and some things you can do without the physician's help. It's about taking control over your life. It's about learning for yourself. The information is out there. There's these tapes, the internet. All this information is out there for public consumption. What you need to do is to digest the information, make some decisions, and start living better. There is a definite balance throughout the entire body. Just everything is about balance. All hormone systems have checks and counterbalances. Estrogen is primarily balanced by progesterone, as we talked about in the menstrual cycle. Estrogen is dominant in the first 2 weeks of the menstrual cycle. Progesterone should be the dominant hormone in the second 2 weeks of the cycle. When estrogen is dominant without the balancing effect of progesterone, you have symptoms of estrogen dominance. And those symptoms will coincide with the functions of estrogen. Estrogen's function is to make things grow and to get bigger. Estrogen's function is to make tissue grow. It makes breast tissue grow. It makes uterine tissue grow. It makes the lining in the uterus grow. And so when you have a dominance of estrogen, you're going to have a dominance of growth. That's why estrogen stimulates the growth of fibrocystic disease and breast cancer. Estrogen stimulates the growth of the uterine lining, and so you'll have irregular bleeding if you have